Assalamualaikum warahmatullahi wabarakatuh, and hi, my name is Nur Atira binti Kamar Zaman, and our group will discuss further about application of X-ray in medical imaging. So, I will discuss about the introduction. We have three objectives. First, to study the medical condition that need a diagnosis by an X-ray. Second, to determine the component involved in X-ray imaging. Third, to investigate potential side effects of X-ray. X-ray used in medical field to generate image of structure and tissue in the body. The uses of X-ray technology is either to diagnose or treat people. The research of the study is to help people detecting their disease that cannot be finalized by naked eye. Besides, X-ray have high energy that can pass through any kind of object, including body. For those who apply X-ray on body many times, they will get side effect in the body. Now for abstract. The uses of the X-ray technology to either diagnose or treat people. X-ray used in medical field to generate image of structure and tissues inside the body. Bone absorb X-ray readily and provide strong contrast on an X-ray detector as a result of this feature. So, how do X-ray work? An X-ray is a medical imaging procedure that creates image of the inside of your body. X-ray beam are a type of electromagnetic radiation that was discovered in 1895 by German professor Wilhelm Conrad Röntgen. Besides, X-ray have higher energy and can pass through any object, including the body. First, a patient is positioned so that the part of the body being imaged is between an X-ray source and an X-ray detector to make a radiograph. X-ray have a variety of effects. X-ray, on the other hand, have an easier time passing through less radiological dense tissue like fat and muscle, as well as through air-filled cavity like the lung. When the machine is turned on, X-ray travel through the body and are absorbed in different amount by different tissue based on their radiological density. Radiology is a branch of medicine that deals with the diagnosis and treatment of disorder through the use of medical imaging. Healthcare practitioners should be educated rational decision about exposing their patient to radiation only when the benefit outweighs the danger. The density and atomic number, the number of protons in atom's nucleus of the materials being photographed, define radiological density. Artificial intelligence and machine learning approach can readily automate the process of creating medical report from radiographic picture. To protect patients from needless recurrent radiation exposure, educating both patient and healthcare providers may be useful.
Bismillahirrahmanirrahim. Assalamualaikum. My name is Rudy. So now I'm going to present about the literature review. Okay, so who is the person in charge to analyze or to diagnose the problem that determined from the radiographic image? The person is a radiologist. Okay, so the radiologist will diagnose the problem from the radiographic image and then write a report that describes the image of the radiographic image. So, the artificial intelligence and the machine learning approach can readily automate the process of creating medical report from the radiographic pictures. So, what is X-ray actually? A simple definition of X-ray is a medical imaging procedure that create image of inside our body. Okay, what is the procedure to do an X-ray? Okay, so first, patient need be positioned so that the part of the body be imaged between an X-ray source and X-ray detector to make a radiograph. Okay, so how X-ray work? X-ray will travel through the body and they absorb a varying amount of the different tissue depending on radiological density. So now I also will explain about the effect of the X-ray imaging. Okay, so when excessive radiation exposure in a short period of time induce radiation sickness also known as a radiation poisoning or acute radiation syndrome, and even death. So it is very dangerous if we use or exposed to the excessive radiation. The second one is the radiation doses, such as those used in radiation treatment. It also has the negative effect as well. What are kind of the negative effect? The negative effect can weaken bone, making them more prone to breaking later in life. Okay? It also might cause dry mouth and then difficulty swallowing. Lower amount of radiation, such as those used in imaging studies, are not known to create long-term health issues. So what kind of awareness should be take or should be looked for? Okay, so to protect the patient from needless recurrent radiation exposure, we need to educating both patient and health care providers may be useful. And then the next one is public awareness campaign should be held on a regular basis, with the electronic media playing a key role.
Assalamualaikum warahmatullahi wabarakatuh. My name is Azmi Azman, and today I'm going to talk about methodology. Process of X-ray. The patient will be requested to remove any clothing or jewelry that may obstruct the examination of the body area in question. If clothing must be removed, the patient will be given a gown to wear. Second, the patient is placed on an X-ray table which carefully aligns the area of the body that will be X-rayed between X-ray machine and a casket containing the X-ray film. To avoid X-ray exposure, body areas not being photographed may be covered with a lead apron. The X-ray beam is focused on the area that will be imaged. The patient must be very still or the image will be blurred. The photograph is taken behind a protective panel by a technician. And lastly, various of X-rays such as the front and the side views during a chest X-ray may need to be obtained at different angles. 3-point bending test. On non-fixed fresh samples that had been frozen for storage and thawed prior to testing, 3-point bending tests were performed with a universal material testing equipment. With a span to height ratio of 20/3, the bearing distance was 20 mm, showing a smaller apparent Young's modulus than at higher rates. The sample was approached at a displacement rate of 0.5 mm per minute with a pre-force of 0.2 Newton. The stress was placed in the middle of the mountings, which primarily caused mode 1 fractures. In the force displacement diagram, the testing protocol was carried out at a displacement rate of 0.5 mm per minute with a bending modulus calculation in the elastic zone of 15 to 25 Newton. The yield point, maximum and fracture stress, and strain were calculated after mechanical testing. Using the manufacturer's software, the dissipated energy until maximum strain and that until fracture were estimated by integrating the area under the curve of the force displacement curve. After mechanical testing, mechanical parameters such as stresses were created for porosity values evaluated using micro-CT, which included the beam cross-section or any volumetric information for calculation. Micro-CT analysis. After mechanical testing, one piece of each beam, half beam length equals to 50 mm, was fixed in 3.5% formalin for 2 days. After fixation, the beams were stored at room temperature for drying. Subsequently, the samples were scanned with a micro-CT 40 scanner at an isometric Vossel size of 10 micrometer at 55 kilowatt peak, and additionally at 8 micrometer isometric Vossel size. Next, each sample was analyzed to calculate the bone volume to tissue volume, representing the porosity caused by the Hessian system for each beam being potentially different, thus influencing the stress calculation. Crack surface analysis. The samples were taken from one femur diaphysis to prevent inter-individual differences from confounding the results. The beams were extracted longitudinally to the long axis of the bone and polished to the exact same size. Prior to grinding, beam specimens were cut from the diaphysis. A 3-point bend test was carried out. The structural stiffness loss, lower curve, was estimated by dividing K0 by K1 in addition to stress-strain parameters, upper curve. The two curves depict exemplary high mechanical competence, upper, and lowered mechanical competence, lower, respectively. The cracked surface was evaluated using opto-digital microscope by dividing the fracture surface by the cross-section of the corresponding sample. This surface was compared to the cross-section of the respective sample. The porosity of each sample was assessed by CT to adjust the stress measured during the 3-point bending test. The upper panel depicts a representative high porosity beam, whereas the lower panel depicts a representative lower porosity beam. Equipment and materials. This table shows the equipment and materials required to make an X-ray machine. First, we need X-ray tube, high voltage power supply, electrical tape, 5 alligator clips, 12 hookup wire, rubber or styrofoam, fan, wooden boards, nails, screws, radiation shielding, and lastly, Geiger counter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Haras bin Muhammad Hanafi, and for this video I will explain about the result and analysis. According to Phillips Mitch research, there are 3 methods that they use to measure the influence of X-rays and gamma rays on the mechanical performance of human bone. They are 3-point bending test, microcity analysis, and crack surface analysis. In 3-point bending test, there is no significant difference in the Young's modulus was detected among the groups, as you can see in the chart A. However, there are significant differences were found between the control group and 31.2 kg group from chart B to E, as you can tell from the figure, especially the changes in maximum stress and strain and work to fracture. Furthermore, there are no differences were found in the control group and the 6.4 mg, 0.008 gray and 30 gray groups, or between these groups with respect to the parameters assessed. Moreover, there is a 17.24% lower yield point in the group treated with irradiation dosage of 31.2 kg than in the control group, as you can see from the chart B. For plastic region, all parameters of 31.2 kg did exhibit significantly lower values than the control group. The structural stiffness loss increased by 11.31% based on chart F. The dissipated energy until Wmax was quantified to be 68.11% lower than that in the control group, and the dissipated energy until fracture was 70.71% lower than that in the control group. For microcity analysis, there is not much going on here. As you can see from the table, the porosity for control group is 4.73 plus minus 1.56%. For 6-point milligray is 4.87 plus minus 1.81%. The 3.58 plus minus 1.3% porosity for 0.008 gray, while 30 gray has 4.45 plus minus 0.76% porosity, and lastly 31.2 kg has 4.16 plus minus 1.25% porosity. For the last method, which is crack surface analysis, opto-digital microscope is used and the analysis of the crack surface revealed a lot smaller crack surface in the 31.2 kg group than in the control group. Those white arrows in the photo E and F shows the crack occurred in the bone. From here, the control group produced a crack surface ratio of 1.31 plus minus 0.086, indicating a smooth fracture surface in the 31.2 kg group. That is all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ashar bin Abu Hassan. I will continue the discussion part. First of all, let us take a look at the sources of irradiation and their non-influence, which is in 4.1. For our general knowledge, our bone is subjected to different doses of irradiation for both research and clinical applications. Although the risk of radiation to the human body is well known by researchers, the benefits of X-rays far outweigh of any potential negative outcomes. Therefore, the human body is exposed to irradiation doses of mgy, which is milligray, in clinical applications. For example, in CT imaging scans. Radiation therapy is applied in clinical settings beyond imaging purposes, and it is being a source of irradiation at a dose of several units of Gray. Since mechanical competence is one of the main factors of bone survival and one of the main parameters used in bone research, the effects of irradiation on bone mechanics have to be considered. By lowering the plastic competence of the bone tissue, high dosage synchrotron imaging has been shown to severely impact the mechanical performance of bone at certain doses. The data obtained in the 31.2 kgy groups proves that the impairment of mechanical properties is in the order of magnitude that was reported by other groups. In this framework, any effect on bone tissue properties should become evident with the selected experimental testing setup when focusing on lower radiation dosage. Now, let's move on to the doses without direct mechanical influence, which is in 4.2. For doses of 30 gray and below, the previous presented results do not show a primary influence on the bone mechanics in bending experiments. This result is greatly important for lab-based CT imaging in the micrometer range. Based on the 3-point bending test results, workflows such as micro-CT imaging prior to and after mechanical testing do not influence the mechanical behavior of the bone. Even so, cell death has been shown in multiple cases as a secondary effect of radiation and may affect bone cells in vivo with subsequent mechanical deterioration by a changed metabolism. Now, we will discuss about the loss of mechanical competence after irradiation, which is in 4.3. The 3-point bending experiments did not show any significant differences in the Young modulus among all 5 groups. This result acknowledging mineral content to be the main driver of the linear elastic mechanical behavior of bone indicate that changes of the bone tissue are mainly induced to the collagenous phase. Due to high energy irradiation, it is most likely that hydroxyapatite may not change mechanically or structurally. The obtained porosity value for each test beam was used to correct the measured mechanical properties to account for possible variations. Now, let's figure out on how irradiation alters mechanical performance, which is in 4.4. Irradiation has been shown to increase non-enzymatic cross-linking, which is NEC, in bone and other tissues. Ribose protectants such as a ribose pre-treatment can protect human cortical bone from loss of mechanical competence by irradiation. In the crack path pattern, the effect of irradiation on crack appearance has formerly been shown after irradiation. In this study, our results indicate brittle fractures occur already at doses in the range of dozens of kilograms, even without cyclic loading, when the interaction of collagen and mineral platelets is disturbed. Our results emphasize that synchrotron imaging at high doses have a severe effect on bone mechanical properties. There were some limitations in this study. One of it is we did not examine the long-term effects of irradiation on bone of living species. Besides that, no NEC quantification assessment was carried out. This study design cannot address effects of irradiation on various bone quality conditions. This study not explicitly address which mechanism of fracture is occurring in relation to the tested irradiation dosage. Moreover, this study has not addressed the exact order of magnitude what irradiation dosage leads to early mechanical decay following radiation. What is the risk that we could get from X-rays? The risk is relatively small, but it increases with cumulative exposure. The more you are exposed to radiation over your lifetime, the higher your risk of harm from the radiation. There is a slight increased risk of developing cancer later in life after X-ray exposure. X-rays have also been linked to cataract in the eyes and skin burns, but only at extremely high level of radiation. Exposure to high radiation levels can have a range of effects such as bleeding, vomiting, hair loss, fainting, and the loss of skin. Even so, X-rays provides such a low dose of radiation that they are not believed to cause any immediate health problems. How can we reduce the exposure to radiation from X-rays? First, ask the healthcare professionals on how an X-ray will help us if there are other procedures that might be lower risk but still allow a good assessment or treatment for our medical situation. Second, tell the X-ray technologies in advance if you are or might be pregnant. Ask if a protective shield can be used. Next, know your X-ray history. Keep a list of your imaging records, including dental X-rays. Show the records to your healthcare professionals to avoid unnecessary duplication of X-ray of the same body part.
For conclusion, An X-ray is a type of medical imaging that produces image of the inside of the body and treatment of disease. X-ray beams are a form of electromagnetic radiation. Because of this property, bones absorb X-ray rapidly and give significant contrast of an X-ray detector. Radiation sickness symptoms including fainting, dizziness, nausea and vomiting, diarrhea, hair loss, skin and mouth ulcer, and bleeding. Awareness campaign should be held on a regular basis, with electronic media playing a key role.